You know that feeling when everything just clicks? Your mind is sharp, your mood is steady, your body feels like it's firing on all cylinders. That's not luck, that's what your body is capable of every single day. Now, I've looked into a lot of fish oil supplements, and honestly, most of them are mystery sourced, overprocessed, blasted with heat, and packed with synthetic add-ins. But this one is different. Omega-3 Rejuvenate from Big Bold Health starts with wild Alaskan salmon and cod, sustainably caught from some of the cleanest waters on the planet, and then it's processed at low temperatures to preserve what actually matters. We're talking about real omega-3s, naturally occurring vitamins A and D, and pro-resolving mediators, or PRMs, that help your body balance its own immune response. What does that mean for you? Clearer thinking, more stable mood, and real nature-based support for your heart and immune system. No shortcuts, no synthetic nonsense. And it was developed by Dr. Jeffrey Bland, a true pioneer in the world of complementary health. If you want to feel the difference, go to bigboldhealth.com/Hoffman. That's bigboldhealth.com/Hoffman and use code Hoffman for 20% off site-wide. Once you feel it, you'll know. Welcome to today's Intelligent Medicine Podcast. I'm your host, Dr. Ronald Hoffman. The theme of today's podcast is how to overcome pain and heal from injury. The book in question is entitled Rehab Science. And just some background, when I booked this interview, I said this would be interesting because a lot of us may have some occasion to undertake physical therapy. A lot of us are active. I personally am a triathlete and I endeavor to exercise, and with exercise comes the potential for wear and tear and injury, and it also is associated with the aging process itself. So this is a universal theme. A lot of us experience minor, sometimes severe injuries. Some of us are faced with the potential for joint surgery, even joint replacement. Today we're going to talk to an expert, Dr. Tom Walters. He's a board-certified orthopedic physical therapist, and he's founder of Rehab Science. And when I booked this interview, I said, this will be great. Often I get books in the mail, and they're a discussion point. But I was really excited to receive this new book, Rehab Science, this weekend for show prep, because I always like to read the books that our authors write. And I was blown away. So compliments to you, Dr. Tom Walters. This is a book that I recommend to all of our audience as a wonderful encyclopedic resource for how to prevent and address common injuries. And I don't care whether it's your feet, your ankles, your knees, your back, your hips, your neck, your shoulders, your elbows, your hands. It's all there with beautiful illustrations. So kudos to you on a wonderful achievement. The book is Rehab Science. And we're going to talk a little bit about how to address injuries, but not so much with the current model, because our current model is we wait till we have a serious injury, then we're off to the orthopedist, and either the orthopedist says, okay, you're a candidate for a procedure. The big ticket procedures are joint replacements these days, and there are very few people who reach the age of 70 or so without a little piece of hardware in their body, or alternatively, will get a steroid injection, or alternatively, the orthopedic surgeon may say something to the effect of, okay, great, we're not, if they're conservative, you're not quite ready for surgery, go to physical therapy, go to PT. We're going to talk a little bit about what physical therapy has to offer, but what you can do to avert injuries. I think that's really the theme of your book, Dr. Walters, right?
That's so true. Yeah. Dr. Hoffman, first off, just thanks for having me. Really excited to be here. Thank you for all the kind comments related to my book. So much of what I do online and in the book was exactly what you're talking about. It was teaching people therapeutic exercises that most people think about physical therapy just like you talked about, implementing physical therapy or rehabilitation exercises and interventions once they already have pain
Yeah.
or are injured. But one of the messages I really try to get across to people, growing up as an athlete, in different sports, like you were talking about, I've had plenty of triathletes. I live in Santa Barbara, California, so I get a lot of runners and swimmers with injuries and participate in sports like you do. But one of the messages I try to get across to people is that a lot of the exercises that we do in physical therapy will also help reduce the chances that you suffer an injury or have pain. And especially when it comes to things like mobility and resistance training exercises. Resistance training is what most people think of as strength exercises, but those exercises are so important in terms of boosting the capacity of your musculoskeletal system. If you think about your muscles and bones, your tendons, ligaments, they're all very mechanical tissues. And the great thing about resistance training is that when you put graded doses of stress on your musculoskeletal system, it becomes stronger. And if your system is stronger, you're less likely to tear something or injure something. So I think most people understand that logically when you explain it to them, but so many people, when they end physical therapy, just kind of stop doing a lot of the things we talk about. So a lot of my mission has been to help people think about exercise not only from a cardiovascular standpoint, just general health standpoint, but also protecting their musculoskeletal system.
I would argue for a program of lifetime musculoskeletal prevention, when it comes to the joints and when it comes to the core. These are so important. And my personal history is that I would characterize myself early on in my athletic career as a bit of a running fool, i.e., my shorthand for exercise, I was very busy, really engaged professionally as a physician. And my idea of exercise was to strap on some sneakers, get out of bed, strap on some sneakers, run out the door, do my, 4, 5, 6 miles, and then, take a shower and go to work. And what I'm seeing now is a little more of a trend that's emerging among younger people. I see them in the gym, and they're doing a lot of core exercises. They're doing a lot of exercise that supports their hip joints, their shoulder joints. They're working on flexibility as an adjunct to their athleticism. And I think there's an expanding consciousness of, I would argue for, just as we teach literacy in school, we should teach back literacy. Because think of all the back surgeries and terrible, debilitating back problems that could be averted if people started early in life to learn a little bit about the care and maintenance of their back.
Yeah, I couldn't agree more. I think just a general kind of movement literacy. I taught kinesiology at the college here for 10 years to undergrads, and it always amazed me that, now I have 2 daughters who are 14 and 12, that there's not really any kinesiology education growing up, and you have this one body you have for your whole lifetime. And I just think it's kind of unbelievable that we don't teach any of this from a kind of theoretical academic standpoint, or even just, we have PE classes and things, but those classes don't usually dive into what are the planes of motion that your body moves through, and what do these different muscle groups do. And I think it could be it's such a powerful topic area to learn about. And it's I think, when you think about that movement literacy standpoint kind of component, I do think it's interesting. I see more and more younger people engaging in what are more similar to kind of like physical therapy exercises. They're in the gym. This is how I grew up. In 7th grade, I was lucky enough to have a PE teacher who was a strength and conditioning coach. And so I learned kind of weightlifting form and technique and how to keep myself safe. But I basically learned resistance training, and it's been a lifelong form of exercise for me. So I do think it will be interesting to track some of these younger generations, because we do see so many age-related issues like rotator cuff tears and hip and knee osteoarthritis. And I think it'll be interesting to me, I think, just from kind of a curiosity standpoint, to see if we see any reduction in the prevalence of those disorders as younger people are hopefully protecting their system and engaging the right exercises. Of course, you could do the wrong, you could have too much weight or too much form, but injure yourself on the flip side too. But I do think I really wish we had more of a movement literacy kind of component in just high school education somewhere along the line.
Well, there's this motto in exercise, no pain, no gain. But the ethos of no pain, no gain doesn't work well past a certain age. And in fact, I'm seeing so many young people ending up in physical therapy. They're pushing those, 220-pound bench presses. They're doing, the hack squats with enormous weight. They're signing up for half marathons and marathons. And maybe, just maybe, they need to be working on the infrastructure that enables them to perform at such high levels. They're putting the cart before the horse, in effect.
Yeah, it's so true. You really have to think about movement and exercise as a dosage like medication. There's an appropriate volume of exercise, intensity. There's a specificity to exercise. And these are all these principles you learn when you kind of study exercise science a little bit. And I think, you do see so many people kind of have this mentality of just push really hard, no pain, no gain. And when we think about the musculoskeletal system, all of those tissues have a certain capacity. And I think the risk a lot of those younger people run into, as you get older and you've had a few pains and injuries, you respect, I think, your symptoms a little more. You're a little less likely to go from 0 to 100 miles an hour right away. Mm-hmm. I know I'm 44 now. I'm much more disciplined about having a warm up and not putting so much weight on the bar right away, or not nearly as much weight as I would have lifted in college. When I was younger, I would have just jumped straight in. I wouldn't have had a warm up. You can get away with some of those things when you're younger, but I do think there is a risk there. Like you said, if you don't kind of build that foundational capacity of these different tissues, you do run the risk of maybe having a traumatic injury, or maybe you have something degenerative. Maybe there's a lot of the conditions people have are degenerative, right? They're not one single instance. They're something that builds up slowly over time. And so, I have an orthopedic surgeon friend here that I talk to quite often about this, and he always talks about the concept of joint preservation. So exercise is basically a way to preserve your joints, right? But if you do exercise that's too hard, that your system isn't ready for, too much weight on the bar, you run the risk of actually harming your joint and losing all the benefits, that exercise had in the first place. So I do think people have to think about movement exercise specific to their situation, specific to kind of their training state, their tissue capacity. And this is why if you have a good coach, right, if you have a good trainer, they will build you up slowly. It's this principle of progressive overload. So if you're doing strength training, you're slowly putting 5 or 10 pounds more on the bar, you're tracking it, you're really letting your system build that infrastructure so that you're less likely to get injured.
Well, I'll give you a personal instance of this, anecdote from my own personal experience. I never underwent physical therapy until recently because it was last summer that I was taking a run. I'd actually taken a pretty long swim, and then I decided I was going to do what's called a brick workout, which is a swim run. That's part of the training for triathlons because you have to, kind of rapidly segue from one form of exercise. It's swim, bike, run. So I decided to do a swim and a run. And then I took what was a relatively short run through my neighborhood. And then I pivoted to make a left turn. And suddenly a pain shot up my left upper leg. And I actually ran through it. I ran home. But then I realized I'd had an injury. And I thought, okay, well, this is going to be bothersome for a couple of weeks. No biggie. I'll just take it easy. But the pain persisted and the pain persisted, and the pain actually, it started interfering with walking. And so being a doctor, I can self-refer. I wrote myself a prescription for physical therapy, and they said, great, we started physical therapy. But they said, you really need to check in with an orthopedist, a hip specialist, because, for insurance purposes, but also really to see if there's an underlying problem. So I go to the hip specialist. The hip specialist tells me I need an MRI. I get the MRI, and he puts the MRI up of my left hip, and he kind of strokes his chin, and he goes, yeah, it looks like there's about 3 or 4 things going on here. You have a torn labrum, you have tendinosis, you have a little bit of an impingement syndrome, and you probably have something going on from your back. And I have to say that looking at the MRI of my 70-plus-year-old hip was very demoralizing for me. And I said, what can you do? And he said, well, you definitely don't need a hip replacement. I said, okay, great. But short of that, what can you do? And he said, well, we can do a steroid injection deep into your hip. And I said, what does that entail? What's a long needle? And we do it under anesthesia and under visual. And I said, I think I'll just keep up the physical therapy. And so I doubled down on my physical therapy. I wanted to avert that steroid injection into the hip. And lo and behold, I have to say, fast forward, and I'm going to find a piece of wood to knock. I went through the physical therapy. I was very zealous about it. What it taught me was that I had been an inveterate runner, swimmer, cyclist for decades. And yet I realized I had some real deficits. I had some real weaknesses that actually did not support what is called my hip rotator, all these supportive muscles around the hip. And by strengthening those muscles, in spite of the fact that I had kind of a demoralizing looking MRI, and what that taught me is that structure does not dictate function. And that's actually a message that resonates in your book, is that you can have a kind of a, ugly looking spine, you can have a rotator cuff tear in your shoulder or, a herniated disc in your neck, and you can still overcome it, which is, I think, a hopeful message.
Oh, yeah. It's one we try to talk about all the time now. There's so many research studies, MRI studies, where they take asymptomatic people who don't have pain, and put them through MRIs. And it's, around 40% of the population have meniscus tears, labral tears in their hip and shoulder, disc bulges, disc herniations. It's so we really try to.
It's one of the downsides of the ubiquity and ease with which we can get MRIs in this country.
Yep, it's so true. Yeah, there's been a lot of. Now, some of the, like in the low back research, there's been kind of some pushback now where the whole medical system has sort of kind of come into agreement of we won't order an MRI for low back pain right away because they've seen the outcomes are worse with people. If you just send them to physical therapy, they tend to do better because people see that. They don't have your knowledge.
I'm screwed. Yeah,
they
it's
get scared.
Yeah. Actually had that happen with our trainer for, these very vigorous spin sessions that we do. He was like walking with a cane one day and he said, and he was very down because he said, I had an MRI, it looks really bad. And I said, just take it easy and, it's going to take a while. Sure enough, 4 months later, he's back on the bike, leading classes, cycling vigorously, but he was so bummed out when he saw, they said it's really bad. I've got a disc herniation. Well, without any intervention other than just, some light physical therapy, ramping up gradually, he's overcome it.
Yeah, that's amazing. And it's like you said, most people, because we don't have this most people don't know much about their body. They don't know about the different muscle groups, the different planes of movement. You'll often find that when you test people, they do have different mobility and motor control and strength impairments that they don't even know are there and don't really affect them with just general daily tasks. But, like your hip example, you have someone who has hip pain. Maybe it's related to those structural issues. Maybe it's not. You never really know for sure. I always say imaging is just kind of one piece of the puzzle, and it's helpful to know, but it doesn't actually change a lot of what we do in physical therapy. Sometimes patients think that imaging is really going to dictate what you do, but it really doesn't, right? It's the symptoms and the person's function and what you measure in your evaluation. And you'll often find that people say with hip problems, you measure their hip abductors and you find weakness in gluteus medius and minimus, and you find weakness in their hip rotators. It's very common.
Even with people who are ostensibly strong, even with runners and cyclists, it's a different kind of action that is required to strengthen those supportive muscles.
Yep. And they're kind of like the rotator cuff of your hip. And most people don't know about them, because most people are thinking about their glutes for aesthetic reasons or just for functional reasons, right? But most people aren't thinking about these little smaller gluteal muscles and their deep hip rotators. So
they're stabilizers.
Yeah, exactly. Yep. Just like the rotator cuff of your shoulder, and you need those to help protect the joint and protect all those tissues like the labrum that goes around the joint. So yeah, it's and that's so much of what I think physical therapy is often they are these kind of smaller, what I call therapeutic exercises where you're targeting very specific movements or specific muscles, and they're sort of a complement to the rest of your training. You're never telling the person this is all you do. Most people find physical therapy exercises to be kind of boring. So you're trying to figure out how you can kind of work them into their normal training, keep them on their normal training as much as you can so their symptoms don't flare up. And then you just sprinkle in some of these, adjunct kind of exercises.
Because the normal training is where you kind of get that payoff of like the laps in the pool or the amount of ground you cover cycling or running. Whereas physical therapy, sometimes I find it's kind of aversive because you're like doing stuff that you're not used to. And, you just feel kind of like you're not strong in those areas. But those are the deficits you need to correct.
Yeah, yeah, and I think that's where if you can figure out how to work it in with people into what they actually enjoy, they're much more likely to do it. I remember when I've been a PT now for about 20 years. I remember when I first started, I'd send people home with 8 or 9 exercises. Nobody did all that, So nowadays I'll give people one or two. It's like just figure out how to work these one or two in for the next week or two with your normal training. Maybe we modify your training volume a little bit. A lot of physical therapy actually is load management, so we're trying to figure out what are they doing in their current training program? So say they're a runner. Maybe we need to dial your volume back, just maybe a little less volume of running. Maybe it's not running hills. And then just for temporarily, but keep you on a running program. And then, so we've got the load management piece. And then can we add in these therapeutic exercises that help make the tissues that you stress with this exercise more resilient?
Okay, folks, at this point, let's pause and allow one of our sponsors an opportunity to share an important message with you. So here goes. Listen up.
Kids don't just bring home homework, they bring home germs. And those germs don't just stay with them, they spread to the whole household. That's why Xlear nasal spray was created by a practicing physician to give parents and grandparents peace of mind. You may not think about it, but your nose is filtering out a semi-truck full of air every single day. Xlear isn't just another spray. It creates an additional layer of protection in your nose that blocks bacteria and viruses before they can even take hold. Yes, even that virus. Supporting your body's defenses right where germs first try to enter. Xlear is a hygiene product recommended for daily use, drug-free, non-drowsy, and safe for all ages. Just a quick spray in the morning and evening helps you cleanse your nose. Don't just hope for protection, create it. Get Xlear nasal spray, your daily defense. Xlear nasal spray is available at retailers nationwide and online. Check out xlear.com for our special offers. That's xlear.com.
Thanks for listening. Thanks for supporting our sponsors. They are what make intelligent medicine a continuing free resource to you. And now back to today's guest, Dr. Tom Walters, board-certified orthopedic physical therapist and author of a great book, Rehab Science. There is a bit of buzz about something called dead butt syndrome and gluteal amnesia. I think it's a beautiful illustration of what we're talking about here. With speaking of like one specific muscle group, which happens to be, it's the biggest muscle in the body, your gluteus maximus, which for aesthetic reasons, big booty, that's sort of in these days, but it's also very important.
Yeah, it's a super functional muscle. It helps with getting up and down from a chair. I mean, lots of functional tasks. Anytime you got to get up and down from a squatting position, in and out of the car, running. I mean, gluteus maximus it helps transfer force from the ground up through your leg into your upper body. It's very important in many different sports and life activities. And it's interesting, this gluteal amnesia kind of concept. I think it's not like most of the time, if you're doing a squat, most people have to use their gluteus maximus when they do a squat. I think what ends up happening is a lot of people can't feel their glutes very well. It's almost more like a sensory motor kind of issue. It's not that they aren't using their
They've lost the muscle memory, in effect.
Yeah, it's like they don't have that connection to it. And so a lot of times we're trying to, we'll use different types of exercises to help the person kind of tap in neurologically into feeling their gluteus maximus. And then and sometimes it's kind of removing load, like bridge exercises are a great example where a person lies on their back, right, and lifts their butt up. Sometimes people can't feel their glutes during bridges, they'll just feel their hamstrings. So we'll do different things where maybe we take a little bit of weight off of their body. Sometimes if you kind of unload the person, sometimes we'll kind of tap their muscle. Sometimes you can use vibration. There are different kind of sensory tools where sometimes the person, when you find the right thing, they will suddenly, oh, now I can feel the muscle. And then it's that old saying of, sometimes you hear this in kind of the neuroscience world of neurons that fire together, wire together. And once you can form that little connection, that mind-muscle connection for people, and it's true for any muscle, but it gets talked about in the glutes a lot. Once you can get the person to connect to that, then they have an easier and easier time. And so you start with easy exercises where they connect to it easily, and then you start to transfer that to things like squats or something where maybe it's a little harder and try to build up that mind-muscle connection.
From what I understand is some of the problem is sitting, which is an unnatural act. It's not very paleo because if you look at primitive tribes, they don't sit in Aeron chairs for hours on end, staring at screens. But part of the problem is that without strong glutes, other problems arise. You end up with, paradoxically, a lot of people think, well, I don't have pain in my butt. But if you have weak glutes, you're going to have possibly problems with knee alignment. You're going to have problems with low back pain, for example. You may have problems with your core because the glutes actually are part and parcel of what keeps you stable and upright.
Yeah, the glutes are so important. We have so much research in physical therapy involving the glutes when it comes to hip problems, low back problems, knee problems. If you think about your hip is a ball and socket joint, and so it can move in all three planes of motion. Your knee, for example, it's technically called a condyloid joint, but it's kind of just mostly a hinge joint. Your knee kind of bends and straightens, right? It has a little bit of rotation, but the knee is really kind of at the mercy of the hip joint. So if you don't control your hip joint well, then your femur, that long bone in your thigh, moves around and maybe you don't control it well. And then that puts stress on the knee, the ligaments, the meniscus, the cartilage. And so the same is true for the low back as well, that there's so much research on looking at if we can help people better kind of activate their glutes and improve strength in their gluteal muscles, it really can help the whole kinetic chain. Because again, your hip is really this major area of force transfer. So when you hit the ground with running or walking, that force is going up through your lower leg, up through your tibia, up through your femur, and then it gets your hip joint, and your hip joint has to then transfer that force to your upper body. If you're a throwing athlete, you still need to, you need to plant your leg on the ground, transfer that force up through your spine and into your shoulder so you can throw a baseball or something. So
right. They say that the best hitters, and I've watched them at the plate, they've got big upper thighs and big butts. Mm-hmm. And you think that it's, hitting a home run is an upper body achievement, but actually it comes from the thrust that you can impart from your glutes and your lower extremities, right?
Yep, it's so true. Yeah, you've got to be able to generate force there. And it's so much of it's rotation in the hip and in the spine. And yeah, that's not way more of the force generation comes from lower. But a lot of people think it's just the arm.
No. All right, good stuff. We'd lay down the groundwork for a discussion part 2. I've got a lot more questions for today's guest. He's Dr. Tom Walters. He's a board-certified orthopedic physical therapist. He's founder of Rehab Science. How can we find out more about Rehab Science? Is there a website? Is there more information there to be found?
Yeah, my website is rehabscience.com, and then I'm most active on Instagram and YouTube, and both of those are at Rehab Science as well.
So people go there, they can look at videos of specific exercises, addressing specific problems and so on. And I got to say that the book is wonderful. It's a great resource. It's got wonderful diagrams on how to do all the important exercises, and you break it down by muscle groups and address specific problems. So really an important, I think, family resource for our listeners. They should get a hold of the book. The book is available through the usual sources, Rehab Science. Okay.
Yep, exactly. Barnes & Noble, Amazon, wherever people like to get books.
Great.
Yeah, and it's exactly as you said. We broke it down by body region, which is how all my social media is run, as well as, sort of looking at different body region, the most common orthopedic conditions, meniscus tears, plantar fasciitis, sciatica, whatever you might have. It's all these common conditions that you'd go in to see a physical therapist for. A lot of those can really be self-managed with the right therapeutic exercises. So that was really my goal, was to just put all that information out there for people.
Great stuff. All right, when we return, more on the subject of how to overcome pain and heal from injury. Most importantly, how to undertake a preventive program so that you don't wind up injured, and so that you can avert becoming the $6 million man with a lot of implants and artificial bodily components, which is so often the case for many in this country. Tom Walters will be right back with more. This is the Intelligent Medicine Podcast.